president. I come to you from Westchester County, New York, and thank you for joining us. While I run through our standard Zoom housekeeping, please put in the chat your name, your pronouns if you wish, and where you are based. Now, as a reminder, that's what I said. Here we go. All right. As a reminder, we're recording tonight's webinar so that we can share it with others and make it available to you. Here we are, nearly 2 months after the world-shattering Supreme Court decision in Dobbs v. Jackson Women's Health. From across the United States and Canada, it's time to talk about WRJ and you, continuing the fight for abortion access. Thank you to Rachel Klein for being our Zoom master tonight, and to Elisa Heisman, our technical guru. If you have any technical difficulties, Elisa's email is in the chat, eheisman@wrj.org. All right, Zoom housekeeping. Number 1, please stay on mute. Please use the chat box to send questions to the speaker. We have left the chat box open because we will be using it during the presentations, but please treat it and each other with respect. Elisa will monitor the chat for your questions, and we'll have time to raise some of them during the collective Q&A at the end. Please also remember that our Yammer Advocacy Hub is a great place for follow-up conversations with each other and with us. Subtitles are available either from the More button or the Live Transcript button, depending on your system. And now let's get to it. It has been a tough 2 months, right? Both personally and as leaders. Tonight, we have a great set of speakers to inspire, update, and inform you. And then I will come back to talk about turning all of that into action without being too overwhelmed. And then if you can stay at the end, we will actually have a chance to take action together tonight with just a few keyboard clicks. And for our Canadian folks, we know that while abortion rights in Canada have federal protection, abortion access is a challenge for y'all between funding and wait times. Folks from many areas around Canada can't get appointments for weeks and have to travel long distances to obtain an abortion. The WRJ materials and resources are for all of us. It always takes a team to bring you a webinar, and tonight is no exception. Thank you to Trish Joseph and Trina Novak, chairs of the WRJ Education to Action team, and E2A member Sharon Miller in particular. Our staff partners, Elisa Heisman, Lily Heyman, and Talia Shapiro-Blank, they are responsible not only for this webinar, but for all of our reproductive health-related resources and activities that we'll walk through tonight, and really the breadth of all of our advocacy work. So to kick us off, it is my great pleasure to welcome Rabbi Marla Feldman, Executive Director of WRJ and a longtime advocacy leader. Both a rabbi and a lawyer, she's a past director of the Commission on Social Action of Reform Judaism, as well as a past URJ Director of Development. She's been a force for change in our movement and our world across many issues, and particularly in the arena of women's rights and equality for all. Marla?
Thank you, Shoshana. Shoshana just made a comment about it's been a tough couple of months. My presentation is going to be a very brief introduction to the topic, is really about the past 109 years of WRJ's advocacy. So it hasn't always been tough, but it certainly hasn't always been easy. With that, I'm going to give you a very quick and brief overview of where we have been as a movement. So if you can go to the next slide, Rachel, as you can see from our mission statement, baked into who and what WRJ is the mandate to advocate for and promote progressive Jewish values. And of course, as women, we do that particularly focusing on issues of concern to women. So in these few slides, you're going to see a lot of photos. These are all real photos of Reformed Jewish women over the years who have been advocating for women's rights and particularly for reproductive rights. So as you can see, our founding mothers were suffragists. And in fact, in the earliest minutes of WRJ, from going back to before we were founded in 1913, you can see them writing about the rights of women to vote and other rights early on. So we come by this work honestly. Through the years, we have worked on the full range of issues that the Religious Action Center of Reform Judaism, the Union for Reform Judaism, our reform partners have worked on a broad range of issues, and we're right there with them. But it sometimes takes women to really lift up women's issues out of the pile and to say, no, this is really where we need to focus and where we need to mobilize. So we are no strangers to the challenges that we are facing today, right now, and we know how to raise our voices when the times demand it. So if you can go to the next slide. So that was a little bit of who we are. This is a little bit about what we do, or at least have done, specifically related to reproductive rights advocacy. So how do we know what issues to work on at any given time? Of course, that changes. The priorities change over time. The needs change over time. We have a democratic process, and those of you who are WRJ leaders hopefully know something about it. When we come together, we actually vote on policy statements. So we take action on the basis of existing resolutions that have been voted upon by the leadership of WRJ throughout North America. And policy statements that are adopted by our leadership in between those General Assembly meetings. And we advocate on the basis of these policies as well as values of reform and progressive Judaism. So what you see on this slide are some of the statements that we have made over the years related specifically to women's reproductive rights. Our very first related statement was 1935, and it was on the issue of birth control, asking very modestly for the right to receive information from doctors and hospitals about specifically birth control information. So, in the 1930s, we were just asking for basic information about birth control. And then over the years, you can see throughout the 50s, the 60s, talking more specifically about abortion. 1977, continuing that conversation after Roe v. Wade was legalized. We didn't stop our advocacy because the needs continued, and the needs to raise our voices to secure those rights and to keep folks from chipping away at those rights, which of course has happened, and up until 2014. So we, WRJ, we understand the long game. We understand the need to keep at these issues no matter how long it takes. And we also know we will win some and we will lose some, but we are going to keep advocating till we win them all. Next slide. So that's a little bit about who we are and what we take action on. This is a little bit about how we do it. How do we advance our advocacy goals? So we're not alone. We don't work in a silo. We have partnerships. Right now, we are very actively involved, Shoshana particularly, and Elisa and Talia and Lily, who were all mentioned by Shoshana, are very actively involved in the Jewish Abortion Action Coalition. Abortion Access Coalition. So we work very closely and collaboratively with others working on this. Some of you whose advocacy goes back a ways may remember RCAR, which was the Religious Coalition for Abortion Rights. Now that's RCRC, the Religious Coalition for Reproductive Choice, the Liberate Abortion, and other coalitions. Of course, we work with our reform partners, the Religious Action Center, which I mentioned a few minutes ago, which right now is working very strongly on voting rights, because of course, all of this hinges on the democratic process and using our votes effectively. So I hope you're all involved in every voice, every vote through your local sisterhoods, your local congregations. Of course, we work collaboratively with Women's Rabbinic Network as well. You've, I'm sure, all been on social media and seen our various messages and Yammer and educational webinars like this one. All together, this is how we mobilize Reform Jewish women through WRJ to make our voices heard, to give ourselves the collective strength that comes from tens of thousands of women mobilizing and speaking with one voice on the issues that we care about. So I'll mention again our advocacy team, who are so key to the work that we do. Of course, Shoshana, who you already heard from, our vice president for advocacy. Elisa Heisman, who's working in the background of this webinar, thank you, Elisa, is the WRJ manager of marketing and communications. Talia Shapiro-Blank, she's new on our WRJ team. She's our WRJ program associate working on advocacy related matters. And in a moment, you'll hear from Lily Heyman, who is our RAC legislative assistant, dedicated to women's issues and working hand in hand with WRJ and our other staff members. And also in the background, Rachel Klein is helping us with the slides. She's also at the Religious Action Center. So thank you very much for that. So that's our primary team, and you'll be hearing from some of them shortly. So just one final slide and more photos to inspire you of those who came before you doing this advocacy work. It's always a bit of a risk to quote oneself, but what is on this slide is actually something that I said several years ago in talking about reproductive rights and knowing that they're at risk and there's no guarantee. And we saw this moment coming. I have to say, just a few days ago, I was talking to the director of the Commission on Social Action of Reform Judaism, Barbara Weinstein, and what she said to me is what's on the slide. WRJ was made for this moment. And as I said in the past, in the coming months, we will need to organize, mobilize, find those partners, preach, teach, lift up our voices to secure our rights. And WRJ women have always done that. We know how to do that. And we will continue to do what they trained us to do. Those who came before us trained us to do. We will continue to educate and organize WRJ women to be effective leaders and advocates for these values that we share. And finally, as I've often said, and I will leave you with these words and then turn you over to Lily Heyman, our Religious Action Center legislative assistant, organized women inspired by faith, we can change the world. Lily, back to you.
Hi, everyone. I'm Lily Heyman. I use she, her pronouns, and I am a legislative assistant at the RAC and WRJ. You've probably seen my face before and heard me a few times as well. So I'm going to give a really surface level, scratch the surface overview of the impact of Dobbs before we hear from a friend at the Center for Reproductive Rights. Oh, from Gutmacher, I'm sorry, Gutmacher Institute. And sorry, I get confused a little bit when we work with so many partners. And so as I've spoken about before, abortion restrictions and forced pregnancy and birth will put many lives at risk. Rachel, you can go to the next slide. This will severely impact people's health, and it will cause some people to even die. This is a racial justice issue, as Black women experience more maternal mortality than white women, and abortion restrictions disproportionately impact those who face barriers to quality healthcare due to systemic injustices. As many of you know, being pregnant and having a baby is expensive and can cause barriers to employment due to the lack of paid leave, childcare, or other parental supports in our country. And abortion restrictions can be devastating to one's economic security. So that is just bad enough, but this also threatens a lot of other fundamental rights that we hold dear. In Justice Thomas's concurring opinion, he urged the court to reconsider its 1965 Griswold decision, which established a constitutional right for married couples to buy and use contraceptives without government restriction, and paved the way for the legalization of birth control for unmarried couples. Several states have already restricted access to contraceptive by cutting off public funding for it, erroneously defining abortion in such a way to include contraception. And access to affordable family planning services equips individuals with the necessary tools to shape their lives and futures, as we all know. Family planning can reduce maternal mortality by preventing unwanted pregnancies, protect the health of children by allowing sufficient time between pregnancies, and help stabilize population growth. Access to affordable family planning services can also disrupt cycles of poverty. So the majority opinion signals a willingness to overturn long-held rights. And Justice Clarence Thomas explicitly wrote in his concurring opinion that the court should revisit other substantive due process precedents, including Obergefell v. Hodges, which established a constitutional right to marriage equality. And while not explicitly said, many have also expressed concern about a threat to Loving v. Virginia, interracial marriage. Beyond the threat of restrictions on receiving abortion care itself, there are numerous other questions and dangerous implications of the Dobbs decision and abortion bans, particularly around the consequences of criminalization. These questions include, will I receive care I need in a health emergency? Does this decision impact access to contraceptives and other family planning services? Is my location or spending data private, and will they be used against me? We don't know if what we're going to spend money on traveling outside of the state to receive abortion care, can that be held against us? How does criminalization of abortion care affect immigration status if you're charged with a felony? Will my ability to obtain a job, housing, a loan, or even my right to vote be affected? Because when you have a criminal history, in some states you can't vote. You have to do a background check to receive a loan, or public housing, or get a job. So it goes beyond just health or receiving not being able to receive an abortion. And all these concerns are compounded for communities of color, which already have less access to abortion care in general and are disparately targeted and harmed by criminalization, as we've seen with other, with the war on drugs and things like that as well. These concerns, like I said, barely even scratch the surface. And as many of us know already, Jewish tradition permits and sometimes requires abortion to save the pregnant person's life. In Dobbs and with the abortion restrictions in the state, one singular narrow religious perspective is being signed into law and being pushed onto us, disregarding minority religious perspectives and limiting our own moral agency and decision-making in accordance with our own Jewish religion. And there are legal challenges emerging across the country in regards to religious freedom, including Ohio and Florida. However, lawsuits on the basis of religious freedom take time. I know a lot of us are antsy. Let's sue because of our religious freedom, but this takes time and sometimes months, years. So it's crucial to be patient, work in coalitions with and consult legal experts in the field, and take the lead from reproductive rights and justice organizations that have been also doing this work for decades. So what can you do? I'll repeat it again. It's crucial that we follow the lead of reproductive justice organizations and abortion providers that have been doing this work, and like us, been preparing for this moment. They need our help. Abortion funds assist people in finding transportation, shelter, and pay for their abortions. You can donate to independent abortion clinics, volunteer, spread the word about abortion assistance hotlines. I Need an A and Abortion Finder for those seeking abortions. And talk about abortion and share your story to destigmatize abortion in conversation. And you can find a curated list on WRJ's website in the blog. And of course, as many of us know, we can also push our members of Congress, and we will have action alerts at the end so that you can participate in urging Congress to pass the bills that we want. Next slide, please. So as we know and we've spoken about before, voting has consequences. as we learned in a WRJ webinar back in January, the states where abortion rights are being stripped away are the same places where voting rights are being attacked. Maintaining democracy and protecting voting rights are crucial to making decisions that reflect the will of the people. And abortion rights are a democracy issue, and they're widely supported. It is important that everyone can make their voices heard at the polls. In Kansas, voters turned out to protect reproductive freedom and reject a harmful constitutional amendment that could have opened the floodgates to abortion bans in the state. This is a voting victory, and it's a result of a long campaign to motivate voters to protect bodily autonomy at the ballot box. Kansans for Constitutional Freedom, and volunteers and activists, including WRJ women, reached hundreds of thousands of voters over hours of canvassing, phone banking, and community engagement to go against this, to encourage people to vote against this ballot initiative. And we must also participate in efforts to encourage voter participation. As we saw in Kansas, strengthening democracy, protecting access to the ballot, and expanding voter participation impacts issues fundamental to our Jewish values, including abortion access, climate change, gun violence, etc. And to get involved with that, you can join the reform movement's Every Voice, Every Vote campaign. EV has postcarding efforts, as well as Every Voice, Every Vote, Every Week, where on Wednesdays, people can join to phone bank, deep canvass, meet partners, and participate in other phone banking initiatives and get out the vote. And keep your eye out. Abortion access will also be on the ballot this year in California, Kentucky, Michigan, Montana, Nevada, and Vermont, or Nevada. I might have said that wrong. Sorry, I'm an East Coast girl. And with that, I will pass it off to Elizabeth Nash, who is the Principal Policy Associate State Issues with the Gutmacher Institute for Public Policy Office in Washington, D.C. She works on a wide range of reproductive health policy issues, including abortion, contraception, insurance coverage, pregnancy and maternal health, fetal issues, refusal clauses, youth and sex education. And this work contributes to the Gutmacher's State Law and Policies series and updates of state policy development. So we are really lucky to have Elizabeth join us today and share all of her extensive wisdom with us. Elizabeth, I'll pass it to you.
Thanks, Lily. Really, it's a treat to be here. And I personally was very inspired by all of those photos because they were really resonating with me around how people have come together for so long to fight for these rights. And we still have to keep going. Okay, so we're not done yet. Anyway, today going to talk a little bit about what is happening in the states around abortion. Obviously, this is all pretty much after the Dobbs decision. So if Rachel, would you mind clicking onto the next slide, please? So this is where we stand. And in fact, I got my slides in late for this presentation and I was feeling very guilty about it. And then I was like, well, you know what, at least I got Idaho on here because Idaho 6-week ban went into effect basically at 7 o'clock on Friday. And what this map here represents, right, are the 15 states with abortion bans in effect, plus Wisconsin, where abortion is unavailable because the law is so unclear. And so when you're looking at this, you're seeing this vast part of the country where, these bans are in effect, and you're really seeing that this is affecting over 22 million women of reproductive age, right? They are living in a state without essentially abortion access or much more restricted access to abortion. And so, what you're seeing is that in these states, well over 40 abortion clinics have stopped providing abortion. So the number of clinics is decreasing and the distances people need to travel are increasing. So, right, so like if you think if you're living in Texas, you're living in Houston, let's say, and you have to go to Pensacola Florida to access an abortion, that's over 1,000-mile round trip. Right? If you were to try to go from Houston to New Mexico to access abortion care, that's a 10-hour trip each way. So we're really talking about, right, how these bans are impacting people, the kinds of costs that they're incurring. Your typical abortion at 10 weeks, whether it's procedural or medication, costs about $550. Imagine adding on these costs around travel, right? Gasoline, if you have a car, or maybe a bus ticket. Many patients are not flying. Many of them have never been on a plane before. And two, we all know how flying is going right now, and getting a ticket last minute is very, very difficult. And then you have delays. So, there are all of these costs, hotels, childcare, you might not get paid time off, right? All of these costs that are going into what these people are experiencing at this time when they just need an abortion. So this is, where we stand right now. If we could go to the next slide, please, Rachel. Here we have the X's represent court cases. So there's a lot of litigation that's ongoing. It's happening in the states with bans, and it's happening to prevent bans from going into effect in a lot of states across the country. So what I'm trying to illustrate with this slide is simply that people are not giving up. We're still fighting. Even in these states where bans are in effect, there are still cases pending to try to either, block these bans, from being enforced, or in the case of Texas, we've seen the US Department of Justice come in and say, let's try to make sure that the exception is actually a real exception that can be used, because, in these states with bans, they often have a couple of exceptions. All of them have a life exception. They may have an exception for very severe physical health conditions. They may have an exception for rape or incest or genetic anomaly, but the way these exceptions are drafted is to be so narrowly tailored that they are unusable. And so what the Department of Justice case in Texas, and they also have one in Idaho, are about trying to make those exceptions usable. So at least for people in some very dire circumstances can get the care that they need. So if we could move to the next slide, please. I wanted to run through some of the more recent action around abortion that we've been seeing, right? So there was recently a special session in Indiana that resulted in an abortion ban. And that abortion ban has some exceptions in it. And in fact, those exceptions were included pretty much due to people coming and telling their truth to the Indiana legislature, right? There's still an abortion ban was enacted. That was essentially a done deal from the get-go. But the fact of the matter is that exceptions were added into this bill because people spoke up, and they really put the legislature on the spot. And it's not all that you would ask for, right? We would ask for them not to ban abortion. That's what we were asking for. But some of these exceptions wouldn't be there had that not been for people's voices. West Virginia is holding a special session, and they are also, feeling the effects of the outcry from the public. In fact, where the bill is, it's in conference committee, and it's not clear it's going to make it out. And so that bill may actually be dead. We'll see over the next week or two, but keep your eyes on West Virginia. And then in South Carolina, you may have seen today, they were holding hearings on an abortion ban that's moving very quickly through the South Carolina legislature. They're not in session. This is all happening outside of their legislative session. We'll see how far it can go without the legislature actually being in session. Right now, these committees are holding hearings and moving this bill around and making some adjustments to it. Right now, South Carolina has a 6-week ban in effect. They're looking to have a near total ban That's what this bill would do, and also really limit access to information about abortion, which is a key, which obviously is key if you're going to try to leave a state to access abortion care. You really need information and support. So that's what's happening in some of those states. I did want to touch on the ballot initiatives in Kansas and Kentucky, the restrictive ones, right? Obviously, Kansas was a huge defeat for abortion opponents. And again, it was because people came to the polls and spoke their truth. In Kentucky this November, we have a measure similar to Kansas that is on the ballot. And we don't know how that one is going to shake out. Before Dobbs happened, the assessment really was that this was going to be approved. Kentucky is a very fairly conservative state, but still people support access to abortion. What the legislature has been doing to ban abortion is not in line with what the public believes, but it's getting people out to be able to cast their vote. That's so important. If we could go to the next slide, please. And with that, I wanted to turn to something a little more positive after we've gone through this litany of horribles. I wanted to focus on the states where there are protections for abortion, right? So you can see the West Coast, the Northeast, some in the Mid-Atlantic, right? Few states scattered in the middle. That's where we really, over the past 5 and 6 years, have been seeing really concentrated efforts to protect abortion in a number of ways, but specifically to provide statutory protections for abortion rights have been ongoing in nearly all of these states, or repeals of pre-Roe abortion laws have been ongoing in all of these states really for the past 5 years. And it's been because they recognized the threat, right? They saw the shifts that were happening in the courts and in other state legislatures, and they knew abortion opponents were really focusing in on overturning abortion rights. And so these states were looking to make sure that, they had sort of a baseline level set with the law. If we could go to the next slide, please, because this is also kind of all the good things that have been happening this year in these states. So here's a long list of both states and actions that have been happening in these more progressive states, right? For a very long time, really for 50 years, it's been very, very hard to get states to fund abortion, right? That's in part why you see so many, grassroots groups in that space, right? We've had restrictions on Medicaid on abortion. Well, right now we have seen states pretty much on the East and West Coasts putting money towards abortion. California has basically put in $200 million for reproductive health and rights, with a lot of it earmarked for abortion, right? We're also seeing states requiring health plans to cover abortion. Maryland and Massachusetts were really, stepping into this for the first time this year. New York and California really some adding to their policies, right? So when we're talking about non-physician clinician provision of abortion, we're talking about folks like physician assistants, certified nurse midwives, and advanced practice nurses being able to provide to the full scope of their practice and provide abortion services. And we've been seeing that expanding over the past several years. And this year, we're seeing it in a few states. We're seeing those statutory protections happening in Colorado and New Jersey. And the newest trend has been the biggest one, right? Protections for abortion providers. This has been a response. You may remember Texas Senate Bill 8 that basically said, we're going to come after providers. Well, these protections are being put in place in all of these states so that, providers can provide abortion in that state to residents of that state, or for people who come from out of state, without the threat of states where abortion is banned kind of coming into the state and coming after them. Right. So like if you're a provider and you treat a person from Texas, the Texas government can't come after you, and your state will protect you from Texas, essentially. So, putting those in place, putting more clinic protections in place. We know violence has been increasing at abortion clinics. We need more protections being put in place. Training for abortion is key, because when states are banning abortion in their medical schools, in their residency programs, it's harder to get abortion training. So we need to make sure that training is still available for providers. And then just to mention those constitutional amendments in California, Michigan, and Vermont, all of these are to protect abortion rights. And hopefully we will see more states moving in that direction soon. And then if we could move to the final slide, please. So this is where we might be going. You know, we estimated at Gutmacher, before all of this really started going, we estimated that 26 states are likely or certain to ban abortion if Roe falls. And so this is kind of what this map is kind of articulating, is that we are expecting to see more states ban abortion. We know there are court cases pending, right? All those little black X's from before, but know that we are expecting more states to move in the direction of abortion bans. But we have these bluer states, right, that are holding the line. And what, you know, we need to do, and it will take some time, is to help work to roll back bans and restrictions where we see them, and support and thank the policymakers that are moving ahead and protecting abortion rights. But so this is where we might be in the next, 6 months or so. Anyway, and with that, I'd like to turn it back over to Shoshana. I hope this was helpful.
Wow. Okay, can we move to the next slide, please? It is really an honor to share this Zoom box spotlight with these amazing experts and leaders. Like many of you, I have processed Dobbs as a woman, a parent, and a leader. Back in January, I shared my own abortion story. This is personal for me, as it is for all of us. And we also have taken on the responsibility to lead others and help them process and respond to this moment in time. Advocacy can be a fire hose. It can be difficult to figure out how to prioritize our time and our resources and to engage people in an effective manner with real impact and not overwhelm them. So tonight, I'm going to share with you the expansive WRJ reproductive rights and access tools, along with some tricks of the trade that you can rely on as you navigate leadership on the issue. So let's break it down together. Next slide. Social justice, sorry, hold on one second. Little technical difficulty, there we go. Social justice is one of the 3 pillars of WRJ, alongside sisterhood and spirituality. The advocacy committee for WRJ is called the Education to Action Committee, or E2A. The name reflects the 3 buckets of social justice work: education, action, and advocacy. Whichever bucket you are working on, you are a champion for reproductive rights and access. There is a misconception that I keep running into, that if you don't march on Washington, you're not an advocate. And that is just not the case. All 3 buckets are needed to bend the arc of history toward justice. So social action, that is addressing immediate needs by taking direct action. So volunteering as an escort at Planned Parenthood is reproductive rights social action. And so is packing period products for a local women's shelter, postcarding to voters, honoring your local poll workers, or joining for a successful call night to voters in Kansas. It's an ultra marathon, and we are here for it together. As I wrote recently in WRJ Today, my attempt to purchase Plan B for my kids right here in New York led to a conversation with the manager and a very distinct change in store policy. Rest assured, Plan B is now on the shelves and available to all in my town. The link to the full story is in the chat. You too can be a reproductive access warrior in your town, subject to local laws, of course, simply by seeing whether Plan B is on the shelves and asking if it isn't. Don't buy it if you have no need for it, but help make sure it's there for those who do. That's social action. Advocacy. That's working to influence public policy outcomes for a particular community or for the wider good. Advocacy can be in your congregation, your community, your state, your province, your country. It's writing to your senators and it's marching in the streets. And it's also convincing your rabbi to speak about abortion rights and access from the Bima. So our final bucket, education. Now, I like to say that education is the gateway drug to social justice work. It's hard not to be inspired to act after learning from Marla, Lily, and Elizabeth tonight. Sharing a WRJ blog post about abortion like the one Lily wrote last week, spending 10 minutes on the topic at a board meeting, holding a WRJ congregational or community educational program are all ways to bring people into the conversation, keep people engaged in the opportunities for action, and make a difference. That's why education is a gateway drug. Sorry, I should say education is an on-ramp. It helps someone come for the period product packing and stay for the postcarding to get out the vote in Georgia. When you meet with your leadership team, instead of focusing on the big question, what are we going to do about Dobbs? Narrow the question to make it manageable and think about how you will fill these 3 buckets in a way that works for your community. What education program might we do? What repro or voting related actions will resonate? And what advocacy do we want to work on in our congregation or in our community through meetings or through marching? And then don't forget to ask yourself, how are we going to balance our energy among the buckets? You don't have to do all the programming and planning yourself. Your districts and WRJ offer opportunities as well. For example, Pacific District is organizing a cross-district Zoom postcarding party, and WRJ will have special call nights with Wrj. Now that we have our buckets, let's go to the last piece, collaboration. Let's collaborate to stretch our resources and make a larger impact. Our speakers tonight actually model different kinds of collaboration. I get to stand for WRJ collaboration with other sisterhoods, your districts, or even folks across the country through the magic of Zoom. Marla is our executive director. She represents leadership, all the leaders in your congregation who you could work with on abortion and voting rights, the president, the rabbi, your educator, committee chairs. They are all collaboration partners. Lily is WRJ's legislative assistant at the Wrj. Now, she wears 2 hats as a collaboration example. First, she represents the Wrj state opportunities. Some states have staffing and state projects, and in others, we have a list of Wrj volunteer leaders for the Every Voice, Every Vote campaign. You can share information with them, and they can share with you. Everyone benefits from these additional opportunities for action. Lily is also a reminder for a second kind of collaboration, to connect with other committees in your congregation, just like WRJ connects and works with the Wrj. Your green team, your inclusion and pride committees, your social action or social justice teams, men's clubs, youth groups, even your Israel committee. These all have common ground on issues of rights and voting that can lead to powerful collaboration and crossover education and action now into the future, and that can also bring more people in. And finally, Elizabeth, she represents the Gutmacher Institute, and that's pretty powerful right there. But she also reminds us of collaboration with local, regional, and national partners. As a New Yorker, I knew we didn't have abortion protections in our state constitution yet. We still don't. So I kept an eye on the local Planned Parenthood site to know when to send an email or make a call to my state reps. And we did it. We got our special session and we are moving the issue forward. Your local and state collaborators know how the issue is being framed in your community and where help is needed at any given moment. They are the experts and they need help. So build or strengthen your relationship with them. Now, while I keep talking, I would love if you could take a moment and share in the chat who you might collaborate with from inside your congregational community or from elsewhere or from inside WRJ on reproductive rights or voting actions. And then hopefully we'll all follow up on that in the coming weeks. Next slide. Okay, our Wrj Tools and Resources. You've got your 3 buckets. You're thinking about collaborators. How are you going to fill these buckets with meaningful actions? First of all, before we get into all the specifics and details, you need to remember 2 things. wrj.org, that's our website. You're going to find most of this there. Advocacy at wrj.org gets you directly to the advocacy team. Easy peasy, I promise. We're going to be talking about loads of links. It's easy to find your way to them. And we are also going to be sending you an email after the webinar with all of the links. Okay, WRJ sends materials to your inbox every week with education, action, and advocacy opportunities. We have online tools and resource guides easily accessed on the website, and we have peer-to-peer conversations you can join in the Yammer advocacy group. We have a reproductive health and rights campaign to support this work financially, and we're here to help. District advocacy leaders, amazing, experienced advocates, educators, actors, use them. Your area directors can help connect you to resources. And again, reach out to us, advocacy@wrj.org. These materials will help support you in being creative and effective as you fill those social justice buckets and engage members in this work, and even bring new members and partners to WRJ. And don't forget the voting work for everyone at rac.org/EVEV. Next slide. All right, we mentioned 2 things coming to your inbox. Takes no effort, we'll push the information right out to you, and it's presented in a way that's easy to use and to share. Advocacy Matters is our special edition social justice publication. It comes out every other month. It has stuff that can help you fill your 3 buckets. WRJ Today is our weekly e-newsletter. It comes out on Fridays. In the chat, you'll find three links. 2 are for recent editions of these 2 publications, specifically relevant for the abortion fight. The 3rd link is to sign up to receive these e-blasts in case you aren't getting them already. You can also just go to the WRJ website homepage, and at the bottom of that page, you'll find the place to sign up for our emails. Please share all of these when they come with members of WRJ, and invite other people who might be interested to sign up to receive them as well. Education, action, advocacy, right in your inbox. Next slide, please. Yammer is our, I think back up one to the Yammer slide. Okay. Yammer is our private WRJ online conversation tool. In the chat are the links you need to connect with Yammer. And once you are part of Yammer, you can join the Advocacy Yammer group. There you will get updates, action alerts, program opportunities, and you can ask for and receive ideas and help from other leaders and advocates in WRJ. On our website, we have a section dedicated to reproductive health and rights. The direct links are in the chat. On that page, you'll find our campaign through which you can financially support our WRJ reproductive health and rights work. And then these purple buttons at the bottom will link you to all of our resources. So let's take a look around. Next slide. Our resource guide, first up. As you can see, this is a comprehensive guide that covers everything from language choices when talking about abortion today to fundamentals of American, Canadian, and Jewish law on abortion. It also has loads of creative, sometimes even unexpected ideas to help you fill those social justice buckets, and links to the various WRJ resolutions. And finally, materials to share gives you all kinds of resources and materials that can help you in your planning. Next slide. We also have a Postdobs resource guide because things are moving quickly on abortion rights, as Elizabeth summarized for us tonight. So we have this joint resource that Lily updates regularly. It's called the Path Forward on Abortion. It's closer to a 2-pager than a 1-pager, and it has the most up-to-date materials. We're going to go through what it has now really quickly together. Next slide, please. We have immediate actions to protect abortion access and other resources and actions linking you to the nonprofits that are on the front line, the ones that Lily mentioned earlier. We've got hotlines, ways to connect people to abortion providers, and how to fund the vastly increased costs of travel, childcare, and the abortion itself. Next slide. The path forward on abortion also has information to support abortion providers and seekers, to work on destigmatizing abortion, and a wealth of advocacy opportunities. Next slide, please. To keep up on abortion laws across the states, of course, it links you to the Gutmacher Institute. I urge you to visit that site. It has a wealth of information and is constantly being updated. And finally, we have Jewish resources for you to use and to share. It really is a comprehensive path forward to help you fill those education, advocacy, and action buckets with the most up-to-the-minute facts and opportunities. Next slide, please. All right, here we are back on the WRJ website, kind of your main base for this material. These buttons will get you to all of these resources. First buttons are to the 2 guides. Then you have a button to get to all of our WRJ resolutions and statements, another way to find the guides, and then a button that will give you a list of potential collaborators to start your process of finding people to collaborate with. Gutmacher is there too. We really have done our best to make it easy for you to find these resources. Get to the WRJ website, and you don't have to remember the exact path to get there. And even from Yammer, you'll find a link to the website. Again, we're trying to make it as easy as possible for you to access what you need. Next slide, please. Using these tools or the work you've already begun, what will you be doing in the coming weeks to join in the fight for reproductive rights and access? Let each other know in the chat whether you're going to fill up education, action, or advocacy next, or maybe you're going to do a little bit of all 3. Do you have something planned already? Your ideas can inspire someone else's actions, so please throw them into the chat. Tonight, Marla inspired us for the ultra marathon ahead and reminded us that WRJ will be bringing forward new opportunities to engage and be engaged and be educated on a regular basis. How will you share what you learned tonight? Will you forward the follow-up email and the link to educate other leaders in your community? What actions will you take? Will you sign up for and engage people in voting work through the RAC? Will you postcard and plan? Will you pack period products or fan out and check the Plan B in your local drugstores? Maybe when we get off this webinar tonight, you can just tell Siri, or in my case, Alexa, add Plan B to my grocery list.
You already have Plan B on your grocery.
For advocacy, will you reach out and make or build upon a relationship with a local provider or tap into national networks? This one we can help you fill right after the Q&A. Stick around, and Lily has a quick new advocacy for us to do tonight. It doesn't have to be hard or time-consuming to make a difference. And don't forget, we're here to help. You can post a question in Yammer, help each other, send me a direct message from there, or reach us at, we can all say it together, advocacy@wrj.org. And now we're going to have a chance to take a few of your questions. Elisa, do we have some questions from the chat?
We do have one question from Deb Lelchuk, who wants to know from Lily that she saw postcarding in Kansas before the ballot measure. Will there be postcarding on the ballots in Kentucky, Michigan, Montana, Nevada, or Vermont? And what organizations will lead the way?
Yeah, so we are in the process of getting connected with for Michigan, Detroit Jews for Justice, and also Michigan Reproductive Freedom for All. So we're in beginning talks with them. We won't know those efforts don't start really until the beginning of September. They submitted their all of the signatures to get it on the ballot, but haven't transitioned yet. So we are in talks to partner with them and hope to have some phone bank nights and things like that. And that is where we've identified, we think that we'll have the most help, but we are open to talking with the rest of you in different states about actions we can take together in your state.
Great, thanks.
We will definitely keep you posted.
Great, thanks, Lily. Elizabeth, Marla has a question for you. On your initial slides, Florida is listed as having a 15-week ban, but the last slide had Florida anticipated to be a near total ban. Is there pending legislation in Florida that will further restrict abortion access?
So I think, Marla, you get the gold star for paying attention to two maps on two different slides. So yes, so there's no pending legislation just yet. So this year is when the 15-week ban went through the Florida legislature, got signed, and it went into effect on July 1. There's a case pending against it. People are very concerned about this case because the courts in Florida have shifted much further to the right in the past several years. As far as the legislature and the governor goes, we are quite concerned that there will be a very strong effort to ban abortion at a much earlier point in pregnancy, this coming in from January when the session starts next year. Basically, the day that Dobbs came down, the Governor DeSantis said that they would do everything in their power basically to restrict access to abortion. And then he hasn't called a special session. So legislators have been asking him to call a special session and he hasn't done it. So what we're anticipating is that those legislators will shift and start getting their ducks in a row for the next session that starts in 2023. And so we are anticipating some movement around abortion bans, and it would be really wonderful to be able to, for people to raise their voice against that, because Florida has been a place where there have been restrictions put in place, but access has still remained pretty available. There are about 60 abortion clinics in Florida. So it's a place also where people come from other states. So it's really critical that we do defend access. Does that help?
Okay.
Great.
Elisa, do we have time for one more question before we go to the action?
Yes, we do. Marsha Muller wants to know what travel opportunities are there for women who wish to volunteer on the ground in other states at abortion providers, either as escorts or some other role? Or is it just better to donate to local providers and let their local network do the groundwork?
I can take this, and then Elizabeth, if you have anything to add, please be sure to. So a lot of abortion providers have gotten an influx of requests for volunteers and are overwhelmed and are doing a lot. They have a lot more patients than they did before because they have people from other states, and they're managing a lot. So we definitely would encourage you not to travel anywhere to help someone receive an abortion. When we talk about travel, we talk about people who need to cross state lines to receive abortion for themselves. So in terms of volunteering, I would encourage you against traveling to volunteer. It is definitely better to donate and support local providers and the network that is already on the ground doing the work. We don't want to create any new networks or underground networks. We really want to support the networks that have been building over the last few decades and that already exist, and tap into those local networks. I hope that answers your questions. And donating to an abortion fund is a great way to do that, because they help support people with their travel expenses and childcare expenses and things like that.
Okay, thank you.
Well, Elizabeth, if you have anything to add, I don't know if you.
I would just support 100% what you just said, and know that pretty much no matter what abortion fund you are donating to, you are going to be probably end up helping somebody travel, right? Because if you're like in New York and you're donating to a local abortion fund, they are helping people get from like Oklahoma to New York. So it's pretty much, you know, or you could donate to the Roe Fund in Oklahoma, but also you could help, you know, with the abortion fund, you can, that is a place to volunteer, is the abortion fund. You can receive training and become a person who helps people navigate the situation. But really donations are key right now.
Thank you. Next slide. Okay, so unfortunately, we do have to end the Q&A now. Thank you, everybody, for being here with us. If you have additional questions, drop them into Yammer and we will follow up. And also, if you stay on for the action with Lily, we can keep chatting amongst ourselves while we're doing that click action. So I want to say a thank you once again to Elizabeth Nash from Gutmacher Institute, to Lily Heyman, to Rabbi Marla Feldman, to all of the WRJ staff and leaders who made tonight possible, and to all of you for being the social justice champions that you are. And since we know that after this webinar, you're going to be planning social justice activity inspired by tonight, 3 things you need to know for the WRJ advocacy calendar in the fall. Keep an eye out for a RAC WRJ voting call night. Please make sure to join us on September 20th as we launch WRJ Says Stop, an initiative against sexual harassment and assault, with our first webinar, How to Build a Safe and Transparent Synagogue Community. Of course, we're going on the civil rights journey, October 19th to 23rd. And finally, on November 30th, we're going to be holding a post-election, looking ahead, end of the year advocacy webinar. And now it's time to act. So Lily, take it away.
All right, so we have a few action alerts for you to do. Rachel, if you can go to the next slide. Awesome. So the first one, if you go to rec.org/postdobs, you can urge Congress to pass legislation that protects fundamental reproductive rights and freedom. This includes the Women's Health Protection Act, the Right to Contraceptive Act, the Ensuring Abortion Access Act, I think is what it's called. It used to be called Ensuring Women's Rights to Reproductive Freedom Act. It also includes the EACH Act, which is to repeal the Hyde Amendment, the Abortion is Healthcare Everywhere Act, and the Expanding Access to Family Planning Act. So it really covers a lot of bases. Then the next one is to urge your governor and state legislators to demand they protect and expand abortion rights. And that's at rac.org/state-repro. And then for more action items, you can visit the Path Toward Abortion, Path Forward for Abortion resource guide, and that has a whole host of links and resources, as Shoshana has walked through so thoroughly with you. And then finally, if you're interested in getting out the vote, you can go to rac.org/EVEV, and you can find different ways to get involved there.
Lily, thank you. Thank you for helping put these together, for bringing them to us, and for all that you do for us and in our connection with the RAC all the time. Rachel, if you can take us off of the slide sharing so that we can all see each other while people can click through. So everybody, you can change your view to gallery. You can take yourselves off mute. And I don't know about you, but I'm already done with the first one. So hopefully you are too. And even if you've done it before, send the message again. Hi, everyone. It's so nice to see you.